Hello, I'm Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Mark Talluto join us. He's the VP of Strategy and Analytics at the Blue Cross Blue Shield Association, and he also leads an important initiative called the Health of America program. Mark, welcome.
Welcome, Solomay. I'm delighted to be here. Thank you for having me. Hope you're doing well this morning.
Yes, super excited to have you. Why don't we get started by, if you could share a little bit of what is the Health of America initiative?
Yeah, great question. With nearly a century of experience, Blue Cross and Blue Shield companies use the knowledge we gain from ensuring basically 1 in 3 Americans who are pretty much located in almost every state and every zip code in the United States, and the interactions that these members have with their physicians, hospitals, and the healthcare system to harness data insights on a wide range of healthcare topics and trends that impact the health of our communities. And so we use that data and those insights to develop powerful stories, to uncover key healthcare trends, and to initiate dialogue at a national and at a local level with community health leaders on not only what the problems are, but what the potential solutions are to healthcare issues impacting our communities at large. Basically, there are 3 components to our Health of America program. There's the Health of America report series, which started in around January of 2015. Since then, we have published more than 35 reports. It's intended to drive the dialogue around important healthcare topics, everything from access and affordability to behavioral and maternal health. These reports also enable national and local community health leaders to focus resources on efforts that create effective outcomes. Our second component of the Health America program is our Research Alliance. We've established a collaboration. Today, it's made up of 9 academic research institutions with a shared goal of improving the health of America. These research institutions have access to our commercial claims database, and the data drives the insights into their important research topics that they eventually publish. And then the third component of our Health of America program is our Health Index, which is a unique measure of America's health derived from the actual medical claims experience of our members. It leverages data to identify the top 10 health conditions impacting patients across the US. The beauty of this health index is we could get a national read, we could get a state level read on community health, we could even go down to the actual zip code level and really understand the differences in health across zip codes in each one of the communities that our Blue plans serve, which is pretty much every community across the country.
That's super exciting. And I know Health of America has prepared some really awesome research around various topics like behavioral health, millennial health. Can you share more about those findings?
Yeah, so we with our health index, it allows us to go deeper across a set of chronic conditions and even by age. So I'm going to talk a little bit about that today. With behavioral health, as you mentioned, the statistics that we've uncovered have been staggering. When we looked at the top 10 behavioral health conditions impacting all agents from 2014 to 2018, we noticed that the prevalence increased across those years, those 5 years, for all pretty much except for one condition. And for half of those top 10 conditions, tobacco use disorder, major depressive disorder, substance use disorder, bipolar disorder, and cognitive impairment, we saw increases in excess of 50%. So just think about that, pretty substantial increases. And then we focused in on age cohorts. So we looked at the millennials because we've done a lot of work with millennial health. And with millennials, given that this generation is on track to become the largest generation in the near future, and it makes up a majority of the workforce today, we took a closer look at the health of this generation in 2019 and discovered 6 of the top 10 health conditions affecting millennials are behavioral health related. Since the report, we did our first report in 2019, we did a 2020 refresh. It shows that millennial health continues to decline, driven by notable increases, even in that 1 year, of a 12% increase in major depression with this generation, a 7% increase in alcohol use disorder, a 5% increase in tobacco use disorder and substance use disorder. And, clearly we will continue to follow that. And a few other notable findings include nearly a third of millennials have a behavioral health condition, and the rates are rising by double digits across those third of millennials that have those conditions. And millennials with a behavioral health condition are 2 times the risk of having a chronic physical condition. We often talk about the relationship between physical health as well as mental health, and clearly there is a strong relationship here, and a relationship which impacts the whole body, the whole person. When we took a look at behavioral health by not only across age cohorts, but by race and ethnicity lens, we find that millennials from a majority of Black and Hispanic communities have lower rates of behavioral health conditions, which we talked about a little bit earlier, compared to millennials from white communities. Primarily, it's likely due to underdiagnosis. We're seeing that across a number of behavioral health conditions. And we're going to explore that a little bit further as we move into 2021. Substance use disorder continues to rise among millennials. Those diagnosed with an opiate use disorder are 46% less healthy than their peers across physical and mental health. And treatment varies by race, with Blacks and Hispanics having lower overall rates of treatments than whites for substance use disorder. The implications of these health challenges, are very large. As I said earlier, addressing this decline in health, including the disproportionate burden of disease experienced by particular groups, is urgent, considering the continued downward trend in well-being. And it will take the work of not only, Blue Cross and Blue Shield plans and the Health of America talking about what the results are, and our plans impacting programs which focus in on improving behavioral health, but it's going to take the work of partners across the healthcare system, partners like you're bringing together in the summit, as well as community partners to really solve this important need, because it impacts, when you're talking about the millennials and you're talking about the workforce of America, it impacts a substantial portion of them. And that's why the implications are large, quite large.
That is very staggering. Interesting. Thank you for sharing those insights. Mark, could you talk a little bit about what you're seeing in terms of COVID-19's impact on behavioral health?
Yeah. So we've all been living with the pandemic now for over a year. So I can't say that we've adjusted to the new normal, but as we continue to evolve and adjust to our circumstances, it's important to keep an eye out on the impact of how the pandemic has impacted behavioral health. With so many worried about not just the disease itself, but its effect on other key aspects of our lives, we're seeing data that shows certain behaviors have been on the rise since the outbreak began, especially among, again, younger generations. For example, our data shows that 93% of respondents that we initiated a survey, consumer survey, and 93% of the respondents reported at least one behavior change since the outbreak began, including eating more, drinking more, smoking more, or using drugs for non-medical purposes. Clearly, these behaviors may lead to further increases in conditions like anxiety, major depressive disorder, as well as tobacco, substance, and alcohol use disorder. So we will continue to monitor that over time and see how those impact. What are the longitudinal effects of those behaviors? Most experts agree that COVID-19 and how we've been living with that will lead to a major long-term increase in demand for integrated behavioral and physical health services. Through our millennial research and findings, we did a listening tour, and millennials really want that sort of integration that exists between physical and mental health, and desire that, and when they seek a healthcare provider, and when they're trying to find health services for themselves to address their unique challenges. Knowing this, treating the whole person, really underscores the need to adapt a broader approach to how we can help people find the right care and how we can collaborate to connect that care, either in-person care or digital care or new models of care.
So we know the pandemic has magnified racial health disparities to tragic proportions. As you mentioned earlier, there's probably even more than we realize that are underdiagnosed. How can we address inequities in behavioral health? Great
question. And let me expand on that a little bit in terms of what the Blue system is doing with the Blue Cross Blue Shield plan. Clearly, over the last 15 months, the crisis in racial disparities that has played out during the pandemic in our country is unconscionable and unacceptable. We're seeing it play out daily. While Blue Cross Blue Shield companies and while our plans have made great strides in addressing racial health disparities in our local communities, there is much more that needs to be done. That's why in April of this year, we launched our National Health Equity Strategy to confront the nation's crisis in racial health disparities. We're first going to be focusing in on maternal health, but we will focus in on 4 conditions. The first is maternal health. And those 4 conditions that we're focusing on disproportionately impact communities of color, one of which is obviously behavioral health. As part of the strategy, we intend to change the trajectory of health disparities and reimagine a more equitable healthcare system by, I would say, doing the following. We're going to be collecting data to measure disparities. And the collection of data is really critical. Having race and ethnicity data down to the individual level is really critical, not only for measuring our progress towards reducing racial health disparities, but developing programs that are targeted at the unique individual level. So that's why we need data to really target our efforts around programs that can make meaningful change at the individual level. Scaling effective programs, that's the beauty of the Blue Cross and Blue Shield system and plans. Ultimately, addressing racial health disparities is very contextual, it's very community-based, and we're going to be looking at different programs that our plans have implemented across the country and see which ones are moving the needle on closing racial health disparities, and then taking elements of those programs and seeing what is scalable across other communities. Want to be clear, it's not a cookie cutter approach, but there are elements of programs that can work in other areas that could be overlaid on programs that can make them more powerful and more impactful. We will be working with providers to improve outcomes and address unconscious bias and obviously doing unconscious bias training. And we will be leaning into partnerships at the community level. In order to close the gap in the disparities that we're seeing across maternity, across behavioral health, across cardiovascular conditions and diabetes, it requires an effort on a number of key stakeholders in the community to close those disparities. So those are 4 areas in which we'll be focusing our efforts on. And clearly, foundational to all of this is influencing policy decisions at the state and federal level. There's been a lot of talk about the Omnibus Act and what that does in maternity, but we'll be looking at other policy decisions and state level actions that help enable us to really close the gap in racial health disparities. Like I said earlier, Solome, while our launch focused on maternal health, we'll shift to behavioral health later this year, and we'll launch several reports that focus on major depression and anxiety. Conditions that are severely underdiagnosed, as I stated earlier, and undertreated in communities of color. I'll give you a sneak peek. Elements of our report will examine prevalence rates of major depression by factors like race and ethnicity, age and gender, and look at the existence of comorbid major depression and anxiety. So we'll be looking at depression and the interplay with depression and anxiety. We'll estimate the size of underdiagnosis of major depression and anxiety in communities of color, and we'll also begin to estimate what the diagnosis rate should be in those communities. Finally, we'll explore reasons for the underdiagnosis. Stigma, for example, lack of access to behavioral health providers, and the like. To continue our focus on maternal health, the results will also, our analysis will also report and examine postpartum depression, which is, from our data and our insights on maternal health, we're also seeing an underdiagnosed in communities of color, postpartum depression. And finally, like we did in all of our work, we do a consumer survey will be fielded to better understand patient preferences for accessing mental health care and barriers to diagnosis and treatment with a lens into variations by race and ethnicity. Hopefully, these insights will help drive another very informed dialogue and discussion around what the problems are, what the barriers are, and what the potential solutions are to reverse, obviously, the gaps that exist in the gaps that exist in disparities in behavioral health across race and ethnicity lines.
Wow, you have collected so much juicy data. How do Blues plans use Health of America data?
Juicy data, I like that term. The data allows our companies and our plans to drive and contribute to conversations, both at the national level and at the local level with key stakeholders, and helps really to improve the solutions that Blue plans are considering or offering in the marketplace. For behavioral health in particular, the increasing prevalence of those conditions that I mentioned earlier are a top 10 concern for, let's focus in on employer groups, as that generation is the largest generation in the workforce today, millennials. Studies show that one in five adults experience a diagnosable mental health condition in any given year, with more than half going untreated. As a result, you could do the estimates, and there are a lot of estimates out there. 200 million workdays are lost due to mental health conditions each year, costing employers almost an estimated 17 to 18 billion in lost productivity. That's a pretty big nut. By helping employers not only understand the full scope of behavioral health conditions and their impact, we can help them develop solutions targeted to their unique population that manage healthcare costs, manage the intricacies of not only the behavioral health care conditions, but how that contributes to poor health overall. And we could use that to drive solutions to create a more healthier, productive workforce for them. And in many ways, our Blue plans are doing that today with the rich data that they're bringing to the table and in the conversations that they're having with their employer groups.
Speaking of solutions, can you tell us a bit about what are some of the innovative ways that Blue Cross Blue Shield companies are providing behavioral health solutions within their local communities?
Yeah, there's a range of solutions. I'll hit on a couple of them that our plans are implementing or have implemented that get at a holistic approach to behavioral health care. A few notable examples, and I'll mention here, are Blue Cross and Blue Shield in Minnesota, that they partnered with Learn to Live to offer online programs and self-assessments for employees and their family members living with stress, depression, social anxiety, insomnia, or substance use disorder. It's available to those at no charge, and members at no charge to some members and their families. Learn to Live reports initial findings report a 30% drop in leading depression measures. So having an impact in some of those key depression measures, and a 7-to-1 average annual return on investment for employees. Another example is what Blue Shield of California is doing. They have a program called Wellvolution. That's a tough one to say. Wellvolution is a health platform that matches participants with individualized health and wellness recommendations. Results to date include enrollment of 2 out of 3 people in disease prevention and treatment programs, with outcomes including reduction in weight of 5% and normalization of A1C levels in about 75%. So this clearly is attacking, Wellvolution is attacking the whole person, not only just behavioral health, but the impact behavioral health conditions have in this case on diabetes and weight management. And then finally, Blue Cross Blue Shield of North Carolina is working with Shatterproof, a national nonprofit organization dedicated to reversing the addiction crisis in America. They're working to establish a quality measurement system for addiction treatment programs in North Carolina and nationally. Their business model is similar to how consumers use Yelp to find restaurants or services, by helping patients and their families with a quick and easy way to find high quality treatment options for substance use disorders through its web application-based search platform. A key component of our national health equity strategy is identifying and scaling innovative, successful programs such as the 3 that I mentioned here to accelerate the learnings, the solutions, and to accelerate health equity across the United States and improvements in health equity across the US.
Well, it's just remarkable to learn about the immense trove of information and data that the Health of America team has collected, super unique and interesting insights. How can people learn more, or where can people go for more information?
Yeah, thanks, Salome. Great question. If they want to learn more, you can see all of our 35 plus reports on our healthofamerica.com website. It's healthofamerica, one word.com. On the website, you can also access related podcasts, episodes, ebooks, and webinars. You can also follow the Blue Cross and Blue Shield Association on LinkedIn, Twitter, Instagram, and Facebook for ongoing updates. And it's just been a pleasure of mine to present here, to answer the questions, and to get in front of your audience to talk about this important topic and the resources that are available. So thank you very much.
Oh, thank you, Mark. Really interesting. Appreciate your time and insights. And everyone, definitely check out all of these incredible resources through the Health of America initiative. Can't wait to learn more about the behavioral health reports coming soon. And thank you for your time.
Thank you.